Tonight, frustration building among first responders as ambulances crowd outside hospital emergency departments. Paramedics forced to wait on the wall until a bed opens up for their patient, and it can take hours. Good evening. Thanks for joining us. I'm Madison Wade.
And I'm Chris Thomas. Firefighters say the COVID-19 spike in cases has only made the issue worse. And so we have team coverage tonight. ABC 10's Van 2 has a look at the chaos students, teachers, and parents are facing with people calling out sick more and more.
But first, we go to Luke Clary live at Sutter Hospital with a closer look at these delays and how they're impacting response times to 911 calls. Luke.
Madison, I'm standing outside the emergency department at Sutter Medical Center, but this is a problem. The delays, a problem at multiple hospitals around the Sacramento area. And I've got to tell you, it's come up in my private conversations with first responders on multiple occasions, but they say the problem has gotten so severe now that they are taking it public for the first time.
It's a problem that's been occurring for 10 years. We're just now at an unsustainable level.
Sutter, Mercy, UC Davis. At emergency departments across Sacramento, ambulances crowd outside, patients waiting for a bed.
If you zoom in, you're going to see 1, 2, 3, 4, 5, 6, 7. There's at least 8 ambulances sitting there right now waiting to offload patients into the emergency department.
Keith Wade with the Sacramento Fire Department says his crews are spending hours of their day on wall time.
And then they essentially have to just stand there and wait, sometimes 8 hours for a bed to transfer their patient. In the meanwhile, patient care is suffering out in the field.
With so many resources stuck on the wall, there are fewer ambulances to respond to 911 calls. Patients, too, waiting for hours for the hospital to let them in.
What's their plan? What plan do you have moving forward?
There's always been a plan. Unfortunately, it's very difficult to affect that plan.
Kevin Smothers, Chief Medical Executive at Sutter, says hospital emergency departments are in crisis. Huge demand coupled with staffing shortages.
It's really been exacerbated over the last several weeks to months from that standpoint. We know it's been a problem in the past, but not to this extent.
He says hospitals have discussed bringing in more paramedics or sending ambulances to urgent care or walk-in clinics to ease the backlog. But he says it's more than hospitals and fire departments can do alone.
So we need help politically in order to get the resources to provide those services within the community.
But with a new wave of COVID, first responders fear the situation will get worse before it gets better.
We hope something can get fixed. We're going to continue going out the door and running these calls. It's just a big, frustrating problem for everyone involved.
And all of this wall time carries a number of costs. It costs taxpayers money in terms of man hours. It costs the fire department in terms of resources and morale. It also costs precious time at a time of an emergency when you've got so many ambulances at the emergency department tied up there on wall time, and just how much longer it would take to get an ambulance to a crisis or a place where there's an emergency happening.
Absolutely, Luke, and I understand this is a multi-layered problem, but what can we all do to help with this issue?
Yeah, one aggravating issue recently has been with this latest COVID spike is people are calling 911 when what they really want is a COVID test. First responders would urge you to seek another outlet for a COVID test because if you call 911, you're going to end up going to the hospital, waiting at the emergency department for hours, and a paramedic or an EMT will be right there with you.